Hello and welcome to Medical Dialogues. I'm Mr. Zaman and today I'll talk about assessing catheter ablation in very old patients with non-valvular atrial fibrillation. Non-valvular atrial fibrillation or NVAF is a common type of cardiac arrhythmia, especially an irregular and often rapid heartbeat that occurs in the upper chambers of the heart known as the atria. The term non-valvular is used to distinguish this type of atrial fibrillation from another subtype called valvular atrial fibrillation, which is often associated with heart valve disorders. Catheter ablation of atrial fibrillation is recommended for selected older patients. However, the preventive effects of atrial fibrillation ablation on cardiovascular events and death remain unclear, especially in older patients. In a new study, researchers from Kagawa Prefectural Central Hospital and Hyogo Medical University aim to investigate the impact of atrial fibrillation or AF ablation on the incidence of cardiovascular events and death in very old non-valvular AF patients. The researchers define cardiovascular events as acute heart failure or AHF, strokes and systemic embolisms or SSEs, acute coronary syndrome or ACS, and sudden cardiac death SCD, and cardiovascular death as AHF, SSE, ACS related death and SCD. They compared the 3-year incidence of cardiovascular events and death between the patients who underwent AF ablation, that is ablation group, and those who received medical therapy only, that is the medication group. Among the 782 NVAF patients using direct oral anticoagulants, propensity score matching provided 208 patients in each group. The ablation group had a significantly lower 3-year incidence of cardiovascular events and death than the medication group, that is cardiovascular events 24 versus 43 and cardiovascular deaths 5 versus 15. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.